Dr. Anna Oswald is a rheumatologist and assistant professor at the University of Alberta. On top of her clinical practice, she is actively involved in both medical education and rheumatological research, and has numerous publications in the medical literature. Alright, so welcome to another session of MediViews. Today we're here with Dr. Anna Oswald, who is a rheumatologist at the University of Alberta. So Dr. Oswald, what exactly is rheumatoid arthritis?
Well, Nathan, rheumatoid arthritis is a disease that presents as multiple hot, red, swollen, tender joints. It's painful, and it's due to an autoimmune condition. We call that inflammatory polyarthritis. And this differs from osteoarthritis in that osteoarthritis is a problem because of abnormal repair from injury or wear and tear, whereas rheumatoid arthritis is an immune system problem.
Okay. So what exactly causes rheumatoid arthritis?
Well, normally the cells of our immune system are in charge of fighting infection. But for some reason that we don't totally understand, in rheumatoid arthritis patients, these infection-fighting cells start attacking the lining of joints and other organs around the body.
Okay. So who is usually affected by rheumatoid arthritis, and what are some risk factors for getting it?
Rheumatoid arthritis can affect anyone of any age, but the most common people are in the middle age and women. However, there's also an increased incidence after a woman delivers a baby in the first few weeks to months after that time period. In terms of risk factors, smoking is the biggest modifiable risk factor, and also family history plays a role, but we can do less about that.
Okay. And what are some signs and symptoms that someone may have that makes them suspect they might have rheumatoid arthritis?
Sure. So new onset of red, hot, painful, swollen knuckles in the fingers, particularly the knuckles where the fingers join the hand, or the metacarpophalangeal joints, or the middle knuckles. Also the wrists and toes can be affected, and most people with rheumatoid arthritis find that they feel significantly worse first thing in the morning, and that they notice improvement as they move around more and more. Other signs that you might have rheumatoid arthritis include flu-like symptoms, weight loss, and fatigue.
Okay. And what are some common systemic symptoms aside from the joint symptoms?
Sure. So in addition to the weight loss and fatigue and flu-like symptoms, people can even present actually with hoarseness because the joints in the voice box can be involved. And one of our biggest concerns with patients with rheumatoid arthritis is the increase in the risk for heart attacks, as it's significantly increased in these patients, and that's the #1 reason that they die prematurely.
Okay. How is the diagnosis of rheumatoid arthritis made, and is there a single test that can be used to rule in the fact you have rheumatoid?
Unfortunately, we don't have a specific single test that can rule in rheumatoid. Predominantly, the diagnosis is made by talking to the patient and getting a description of their symptoms that fits and looking at the joints themselves. In addition, we have some tests that help us lean towards the diagnosis, but none of them are specific enough to say yes or no, you have this disease.
Okay. So what are the current treatments for rheumatoid arthritis, and is it a curable disease?
Unfortunately, this is not a curable disease. However, we have some really good treatments for rheumatoid arthritis. And the goal is that people would feel normal so long as they're taking these medications. It does require that they take the medications indefinitely, though. So these medications are called disease-modifying medications, and if they fail, we have an even newer group of disease-modifying medications called biologics. These are very effective, but quite expensive.
Okay. And will they have to be on these treatments for life?
Yes, they would have to be on for life. Occasionally we can stop the treatments during pregnancies because women tend to have spontaneous improvement in their rheumatoid arthritis during pregnancy. But for the vast majority of people, when we stop the medications, the disease comes right back.
Okay. And are there any complications associated with rheumatoid arthritis, such as decreased life expectancy, and is this something that will eventually improve with age?
So absolutely there are complications with rheumatoid arthritis. And because this is an immune system problem that manifests in the joints, this problem can go all around the body and affect organs. Most importantly, life expectancy is decreased, and untreated, a life expectancy of a rheumatoid patient is only in their 50s. This is predominantly because of increased heart attacks. However, if they're treated, their life expectancy returns to normal. Other complications of rheumatoid can involve problems with the bone marrow, the spleen, the lungs, the eyes, and even attacks on the blood vessels.
And will rheumatoid arthritis improve with age, or is this something that will get worse?
If the disease is not controlled with treatments, it will get worse with age, but people who have controlled disease can be stable for many years despite getting older.
Okay. So are there any reliable online resources you can recommend to some patients who want more information on rheumatoid arthritis?
Absolutely. The top 3 that I would recommend are our local site. We have edmontonrheumatology.com. Dr. Stephen Cates has put this website together and has links to lots of the reliable websites available. Another really good one is rheuminfo.com. That one's out of Ontario. And arthritis.ca is the Arthritis Society website, and they have a lot of good patient support resources as well.
Okay, all right. Thanks, Dr. Oswald.